Omicron cases are declining, and we are all cautiously optimistic about the trajectory we are on. Things are moving in the right direction, but we want to remain vigilant to do all we can so that this trajectory continues. As we see the Omicron wave continue to wane, we know that you have many questions regarding what prevention strategies are really necessary for this moment, especially as people are so eager to remove them. At CDC, we provide public health guidance to help communities make decisions based on the risk at the local level, community-level guidance that offers the public information they need to stay safe and protect others. As I said last week, we are looking at all of our guidance based not only on where we are right now in the pandemic, but also on the tools we now have at our disposal, such as vaccines, boosters, tests, and treatments, and our latest understanding of the disease. As we consider future metrics, which will be updated soon, we recognize the importance of not just cases, which continue to result in substantial or high community transmission in over 97% of our counties in the country, but critically, medically severe disease that leads to hospitalizations. We must consider hospital capacity as an additional important barometer. Our hospitals need to be able to take care of people with heart attacks and strokes. Our emergency departments can't be so overwhelmed that patients with emergent issues have to wait in line. We are assessing the most important factors based on where we are in the pandemic, and will soon put guidance in place that is relevant and encourages prevention measures when they are most needed to protect public health and our hospitals. We want to give people a break from things like mask wearing when these metrics are better, and then have the ability to reach for them again should things worsen. If and when we update our guidance, we will communicate that clearly, and it will be based on the data and the science. However, it's also important to remember, regardless of the level of disease burden in your community, there are still very important times to continue to wear your mask. If you're symptomatic or feeling unwell, you should wear a mask. If you're in the 10 days after a COVID diagnosis, you should wear a mask. If you were exposed to someone with COVID-19 and are quarantining, you should wear a mask. I know that everyone is anxious to move beyond this pandemic and some of the ways we have had to change the way we live over the last 2 years. We all share the same goal, to get to a point where COVID-19 is no longer disrupting our daily lives, a time when it won't be a constant crisis, rather something we can prevent, protect against, and treat. Moving from this pandemic will be a process led by science and epidemiologic trends, and one that relies on the powerful tools we already have, including vaccines, boosters, testing, and treatment.